Hey, welcome to the Elle Russ Show, where we explore ways to get healthy, wealthy, and wise. With a combination of guest interviews and solo episodes, I hope you will be inspired and motivated to become the best of whatever you are. I'm Elle Russ, #1 best-selling author and subject expert with over a decade of helping thousands of people across the globe. Visit my website, elleruss.com, to learn more about free guides, masterclasses, online courses, and more. Enjoy the show. Hey everyone, welcome back. My favorite doctor in the entire world, my doctor and the doctor on my book, The Paleo Thyroid Solution, Dr. Gary Foresman MD, is on the show today. We're going to talk all about this very popular wave of weight loss medications, the ins and outs, the favorables, the pros, the cons. Welcome back, Gary. How are you?
It is so good to be here. So
All right,
I'm doing really, really well. And this is actually something I have personal experience with myself because I've tried them. And I can talk knowledgeably about like the patients who taught me about using them because they really wanted me to prescribe them back when you could prescribe them through the compounding pharmacies. And we'll talk about how some of the ins and outs of trying to do that as well. And so.
Okay, so let me just ask this basic question and just explain this to us like we're in high school, okay? So we'll just refer to these are GLP-1. We'll just call them GLP-1ers or whatever. You see the ads for Ozempic. We've seen articles, oh no, it was great for a while, then this happened, and then all these alarming things, but it's been a game changer and a life changer for a lot of people. So just tell us, what are these class of drugs? Like, what do they actually do to the body that helps with weight loss and decreasing appetite?
Well, let me also kind of reframe your question too.
Okay.
And the reason to doing that is because there is, especially in the anti-aging medicine world, this is in functional medicine, it is the thing, which is this whole wave of peptide hormone therapies. And the reason I want people to start thinking of these things as peptide hormones is because it's what they are. And so the first thing that we have to get over is the use of the term drug, okay, versus peptide hormone. And drug has a scary connotation. You and I have talked about.
That's right. It's like thyroid hormone, and people are scared.
Are poisons, okay, except for these exceptions like thyroid hormone. People actually are, even when you talk about a thyroid drug, they get scared because, oh my God, aren't drugs poisons? No, this is a replacement, okay, and this is very important. A replacement of a hormone you're missing when you're using a thyroid hormone, correct? Right? And and of course, thyroid hormone therapy is what we're talking about. It comes in many different ways. That's another podcast. But from T4s to T3s to desiccated thyroid, we could go on, which we've already done. And
right, we've done that already. Yeah.
And of course, those are a very simple, based upon the molecule tyrosine, which is an amino acid, creating this thyroid hormone. Well, peptide hormones are just groups of amino acids. Okay, so a group of amino acids put together is a peptide hormone. Okay. And it's a peptide, excuse me. And then most of the peptides that we use in clinical applications are actually peptide hormones. But so just like thyroid hormone, and they're replacing certain things. And in this case, things that can be downregulated due to many, many factors in our life: stress, poor diet. So many factors can downregulate our ability to create these glucagon-like peptide receptor agonists. So this is GLP-1 RAs. That's the class that became so famous. Semaglutide was the first one because it only works monophasic. It just works on this one glucagon-like peptide receptor agonist, GLP-1. It does that and that alone. After that came out Tirzepatide, which is another peptide hormone. These are all, again, groups of amino acids, about 40 amino acids long. Okay. And so that's the next generation. It has also affects it's called GIP, which is gastric inhibitory peptide. There's another name for it. We don't have to get into it. And then there's, in the coming future, a newer peptide hormone in this area called retatrutide, which might even be better than the Tirzepatides of the world. And I emphasize might be because it works in 3 different ways. Okay. And so directly on glucagon receptors themselves. And so this form of peptide therapy is using a naturally occurring peptide. There's been amino acid substitutions to make it work and make it patentable as well too. But also because it's a naturally occurring substances, you can find them through the peptide companies. Peptide companies are like supplement companies. They have a workaround where as long as you can get these very peptides without a prescription, okay, I use one company called Peptide Sciences. I have no affiliation with this company whatsoever. And it was referred to me by other doctors, by the way. There's probably dozens of these companies that distribute these peptide hormones. The reason I make this a point, guys, and I'm sorry for my rambling nature, is because I was prescribing this through compounding pharmacies, which is my preferred way. Of course, the FDA in its infinite wisdom decided to stop allowing compounding pharmacies to do these to try to shift you back to the original companies who distributed them, which in the case of semaglutide, almost everybody heard about Ozempic for diabetes and Wegovy for weight loss, same drug, same peptide, of course. Okay. And then it was Mounjaro and Zepbound for this Tirzepatide. Okay. And so there's, again, two different names for the same drug, just being marketed differently. And I think the main way to look at these peptides as peptide hormone therapies that are there for some length of time to help you get to your best metabolic health, to avoid getting on a whole bunch of drugs that the doctors are trying to give you for your blood pressure, for your cholesterol, for your diabetes, that eventually are vastly more toxic, do not work as well as getting on something that gets closer to the core issue, is helping people get to their optimal weight and treat cardiometabolic syndrome X, which is an insulin resistance syndrome. So again, I'm still calling them medicines. It's my own thing. These peptides are breakthroughs because they work so well, and when used appropriately, have almost no side effects.
Okay, let's talk about used appropriately because
Yes.
And I'm glad I'm talking to you about this now, and I'm not interested in taking one of these. But I will say that from some of the things I've seen, heard, or read, personal accounts of people who've been on it, work great. Now all of a sudden, they have stomach pain that's chronic and this long-term thing. And of course, you're going to hear about, like, there's people that have adverse effects to Tylenol too, and whatever.
Correct.
You hear about it all the time. So when I look at this stuff, I'm like, never in a freaking million years would I do one of these things, because I would never want to risk those side effects. Of course, just being scared by some stories. But just tell us, you say used appropriately. I'm assuming some of these side effects come from not being used appropriately, or the amount. Give me the rundown. Do you feel that these are just super safe, or are there like really alarming side effects? I mean, I've heard of some of them, and I'm not sure what those actual substances or drugs were, but let's get into that.
So again, the misuse, and this is like as we always talk about, which is if you I was going to be too dramatic there and talk about putting your head in the oven, which is a misuse of a device. Okay, and it can have bad outcomes. Does it mean all ovens are bad? No. Okay.
Right. I get you.
Sorry. So people, when they misuse things, they can get side effects. And that's true for anything in the world, okay? From an oven
I know,
to
and we'd like to think doctors don't
else.
prescribe misusing amounts, but I'm assuming you're saying doctors have just not used it correctly, maybe?
Correct.
Okay.
And that's the real key thing here, is it hasn't been used correctly. So it was originally just being used for the diabetics, and everybody heard about it for that reason. So they think of this as a diabetes drug, which again, you can throw it into that category if you so wish. But what it did is it took us away from the idea that, no, this is just a peptide. This peptide can be misused, or it can be used appropriately.
How do you use it appropriately versus inappropriately? Are we talking like you microdose it versus this, or timing?
Exactly. And the idea is to start off at a low dosage, stay on that low dosage, and then support your body in the meanwhile.
Okay, question. let's say you start the stuff, it's working, it's suppressing your appetite. Therefore, of course, you're not going for the Twinkies. Now you're eating sensibly. You're eating, let's say you're eating paleo perfectly and you're doing all
Mhm.
the stuff. And then let's say you lose the desired amount of weight that you want and you've really gotten your health in order here. Then do you wean off of it? Do you just stop it altogether?
You wean off of it
Okay.
is the answer, and that's the whole goal, is to wean off of it. And so the so I would just tell you that the that for the most part, for my patients, some of them are going to end up on maintenance therapy. I want to emphasize this, okay? So the idea is to put this into this huge realm of, I know you know this data, but it's on the order of 2/3 to 3/4 of Americans now not only just are overweight, but closing in on obesity. Okay, so
Hmm.
that is the number one disease associated that we can call associated with insulin resistance is actually obesity itself, extra fat. And be very clear, everybody, the extra fat cells are their own organ system that is pro-inflammatory within our body, leading to all kinds of diseases that come down the road. Okay. So is obesity a disease? The answer is yes. Okay. It is not a failing of moral character. It's not as simple as just calories in and calories out. There's a whole shift that has to occur to look at the primary underlying disease of obesity and insulin resistance. This whole syndrome used to be called Syndrome X, cardiometabolic syndrome, cardiometabolic syndrome X. It got to be too confusing, inflammation syndrome. But we're really talking about insulin resistance syndromes. Okay. And with that, okay, is the underlying disease, okay, with a multifactorial reasons behind this disease. I want to be clear. Stress factors play a role, dietary factors play a role, exercise factors play a role, genetics, of course, play a role. So and all these types of things, I would just tell you, there's so many reasons for this insulin resistance syndrome. A lot of it has to do to our genetic background, surviving long cold winters and starvation sites and things. Being adapted to being insulin resistant is what saves us when we're living through famines and long cold winters. Okay, so most of us have had some ability to adapt to that. Chronic stress in the world increases that activation. It's called epigenetic change, but turning on the genes that will make you more insulin resistant. Okay. And so there's so many factors that I think go
Well,
in.
and let's jump into cortisol here for a minute, right? Because when you're
Right.
stressed out
Exactly.
all the time, and let's say your body's overproducing cortisol in a way that it shouldn't, tell us how
Mhm.
that then contributes to what we're talking about, because
It's
that affects weight.
exactly. So, and that is just one factor. Remember, it's like how you remember how everybody wanted to make like depression about serotonin when there was drugs for it, and people want to look at the same issue as far as that goes, is that oh, everything in this world is all the effects of stress are mediated through cortisol. It's much more complicated, as you know. There's other adrenal hormones, zonulin, that affects the GI tract and giving you leaky gut, that gives you further diseases. But so yes, stress responses are great short term. Almost everybody's heard of the term fight or flight. Fight or flight responses are great for lions and tigers and bears. Oh my. Okay, you
Hmm.
can't say it without that, really. And but should be very self-limited, because you're either going to escape from the tiger or you're not. Okay, and it's a short-term stress. The lions and tigers of bear today, I used to say, was finances primarily. The lions and tigers of bears today is not just finances; it's the misinformation network that's been cast over our country through social medias, through the right wing. Sorry about that. The right wing media in general. Okay, has been made people to the point where they're not meant to, they feel like they can't trust anything as being true. So they quote unquote do their own research, which is, you can't see me using my dick fingers right now, but doing their own research meant Googling something, usually on a right wing website, and they got misinformed. Okay. And
Mhm.
so this misinformation network, fearing that there is no truth, okay, has, I think, the greatest source of stress for most people, because they've almost lost their ability to rationally think, and you can see that in a lot of factors in the world. So this state of
Well, also
instability.
yeah, and it's not just what you mentioned. It's I agree about that misinformation, and then also on top of that, it's just people would worry about finances, right, or paying for their kids to go to college, and now people are worried about literally if there's going to be a world for their kids, and then also just the state of the world, which usually, at least in recent times in the past, like my lifetime, hasn't been a primal fear, really. There was once a long time ago as a kid, we did drills in case Russia was going to attack us. It was a little scary. But then, like, now we're kind of there again, and that's like an extra added stress that I just don't, people just, we're not used to that
Right.
as
No, we're
Americans,
not.
right?
And
Yeah, we're
so,
just not.
and I even, I send my Leo to school here in Tennessee, and I still think because there's been two shootings at schools in around us that, you could send your kid to school and have him be shot.
Right,
That's not
that's
what,
stress.
that's not the world you and I grew up in, Elle. I mean,
No.
I got in fights when I was in school, but that's what you did. It was like fist fights and, kind of standard male domination stuff. This is crazy. Okay.
Yeah, I didn't have an
Um,
AK-47 pointed at my face. It might have been a
Exactly.
fist,
Yeah,
but
yeah, it was a fist, but that was normal, stuff that you grew up with, right? And so it is not the same world, okay? And so be very clear. The proliferation of guns in our society goes on and on about the
right, all these
factors
stress. So they
that
lead
have
then to us.
downshifted people. Okay, so yes, it does cause adrenaline release, cortisol release, and then you and I both know very simply, everybody, if you have these stress points, you read a horrifying news story. The adrenaline cortisol shift is meant to activate the release of glycogen, the storage of carbohydrates into sugar into your body, just like you ate Skittles or something. Okay, and that sugar rushes out into your bloodstream, and then it says, "All right, what are we doing? Who are we running from? And you don't beat up anything. Fortunately, you're not running from anything in actuality. And then, of course, it all has to be processed back down again into normal blood sugars because blood sugars. Extra sugar in the bloodstream is toxic for you. And this continual response is as responsible as all the Twinkies you would ever want to eat, okay, for this obesification of America. Okay, we'll focus on America for the time being. It's tough to talk about the entire world. And so we have this obesification occurring, which again is multifactorial. The primary driving force behind it is fear cells. Okay. And the fear that people are living in is making this worse and worse. Okay. So, and there's a reason to come back to use this as our template. The idea is that we have the ability to make better decisions than we're making. When we get highly into insulin resistance, which leads to changes and increases in blood pressure, increases in changes in cholesterol, okay, and onto diabetes, the standard person is going to go to a standard doctor and start taking drugs for these things. Okay. And these drugs are going to make them feel worse and worse because they are true poisons. They're going to poison some system that causes the blood pressure to lower, but you will be in worse health because of it. Okay. They'll poison your cholesterol production system. That could be its own podcast, obviously. And the diabetes drugs that are out there are usually not very good. There's one or two exceptions. And I'm obviously going to throw in the GLP-1 receptor agonist as being a class of good peptide hormone therapy that used appropriately, which we'll talk about, can help diminish appetite. And I think it helps with successful weight loss. Just having some success for people that spurs on so much change. When I have somebody says, I lost 20 pounds for the first time in like my entire life. Okay. Because
Oh,
that's the
that
kind of thing.
changes confidence,
It
self-esteem,
changed.
outlooks, everything. That's just like it's amazing.
Bazinga. Okay. Sorry. Yeah. Yes is I'm agreeing with you.
Mm.
Sorry. So it changes everything and you start to feel better about yourself. And I think what happens is in a state, starting to feel good is a good thing. I have to argue against that. And so what we do is we start to feel better and better about ourselves. And I think when we have the ability to feel better, it allows us to be kinder and more empathetic. And again, something the world desperately needs is kindness and empathy, and for all people. Okay, no matter what color, creed, etc. And I think the first, one of my great teachers, I used to wear T-shirts from her place, the Over Center. My teacher's Leisha Dantes. She's passed now, but those peace in the world starts with peace within. Okay. And
Burn fat for altruism.
I know. And it's one of the greatest altruisms of all time because I really want to make sure you hear this. Most people, if you look at their inner conversation, it's not very peaceful, is it? Okay.
No.
And so most people are not working on their own inner peace and they still want to see peace in the world. Think about the what it
Well,
takes
that's
to work
cognitive
around all that.
dissonance, and then
That's
that
it's
becomes a
true
problem.
cognitive dissonance,
Yeah.
exactly. And so the idea is we all need to be working on our own inner peace. Most people who have this by far vast amounts of extra weight, they don't feel good about themselves. Their self-esteem is affected. There's so many things, and they produce. You can see very easily the voting pattern of people who are overweight mirrors this lack of empathy for other people in the world. Okay. So I do hope that by working on people getting to the core root of why, decreasing this appetite for things you don't need. Okay. So let's take us back to this fight or flight mechanisms. We're staying in this fight or flight responses and the cortisols and the leaky guts that develop and all these things that deplete us and fatigue us. We don't feel well. What do we want? We want something sweet to eat. Okay. Or we go back to addiction, right?
Hmm.
We start reaching for the things because we don't feel good. We're going to reach for the things that give us temporary pleasure. Okay. And those can be the classic addictions that everybody knows about. But one of the greatest ones, because it's quote unquote acceptable, is to just eat. And it can be anything. It doesn't have to be Twinkies. It can be pancakes. It can be, Coca-Cola. Here in the South, they drink sweet tea. They drink Coca-Cola. There's like all these breads that are everywhere. Horrible, horrible food for a human being. Okay. But that's the thing that ours going to be reached for, because if you grew up in a culture where sweet tea solved things, you're going to drink more sweet tea. Okay. And
But
so,
I did have a note about sweet because I'm a huge iced tea fan. Like I love iced tea.
right.
Sweet tea just makes me want to just jump off a
It's
bridge.
it's
Yeah.
it's
Oh,
it is so crazy sweet because
oh,
I've tasted
crazy
some,
sweet. Yeah.
and it's a sweetness that if you're not used to it's
Brutal.
cloying. It's what it does to your mouth. It's just, I don't know, like it makes it
Yeah.
pucker almost. Like I don't know.
Exactly. It's
It's tough
horrific.
to
Yeah.
say describe it, but people drink it like by the gallons here. Okay,
I know. Yeah.
and so because they've become adapted to it, but the whole point though is that because of so many social influences, especially fear-based, misinformation-based, we tend to reach for things that are not good for us. They give us short-term pleasure at the expense of long-term health. Okay. The idea, and there's a reason why I think Tirzepatide is so important, is it decreases that impulse. There was and I think it was in the Atlantic, it could have been the New Yorker, are these GLP-1 receptor agonists going to destroy the junk food industry? Okay. And it does go into this movement everybody's hearing about how our junk food is made to be more addictive through all the chemicals that are added, all the dyes that are added. A lot of this is happening to people because they don't know any better and they become basically addicted to very unhealthy foods. Okay. And so how do we break that cycle of addiction? Okay. And in this case, to foods that aren't good for us. As you know, I've been it's not a bandwagon, the primal paleo movement for a long, long time now. I don't even know how long actually, because I always tell people, the basic premises of primal paleo are never going to be wrong. Eat real food. Number
Right.
one. Okay. Eat like a human. Tough to argue with it. Humans are an omnivore. And number three, humans get their carbs primarily through fruits and vegetables. Poof. And it's almost impossible to argue with any of them, okay,
Yeah.
unless you have an agenda, like I want you to eat more, like cereal
Unless you're a
because
vegan.
oh yeah, of course, if you're a vegan. And so it's really the principles are not going to be proven wrong. They just actually can't be, because they are truths. And as I tell everybody, everybody knows that if you eat a chocolate chip cookie, it's because you enjoy it. Please sit down with it, savor it, enjoy that cookie to its fullest revelry, because you're eating it for enjoyment, which has health value. Can things like that, it's because there's a lot more chocolate chip cookie addicts than there are broccoli addicts, okay, for very good reasons, okay.
Although it's funny you said that. My mother is actually a broccoli addict, and she'll to this day she'll tell you she goes broccoli. It's a broccoli every day. She eats broccoli.
Well, there you go. So,
Yeah.
so they're out there. I always joke. There's always the spectrum, and there are going to be those, but there's going to be a lot more than of I know I'm using chocolate chip cookies as an example, but it could be almost anything, right? And so I have, there's this guy in my practice. He ended up getting bypass surgery, and I couldn't get him over. He was eating like 2 bowls of cereal every night, and it was his comfort food. Okay. And I said, dude, with your numbers, you've got to change this. And eventually, hopefully the bypass surgery will get him to the place where he'll actually make some changes. Okay. And we'll get back to getting off the Tirzepatides of the world. But I really do think that these peptide hormone therapies take away some cravings for people. That's their primary thing they do. That is honestly, and I want to be clear, there's potential neuroprotective values to the GLP-1 receptor agonist, especially with this GIP combination. That's tirzepatide, kept at low dosages with support for detoxification, liver, etc. That's the article that's on our website right now. And so on tirzepatide, how do you support the body while you go through weight loss? Because it's a really interesting thing, because losing weight is really difficult. And I'm back down to a weight using tirzepatide, but like the nice thing about losing weight with using it is you don't have to be so hungry that you're cranky all the time. And it makes a tough job more doable. That's all tirzepatide does, by the way, is it makes a very tough thing, weight loss, more doable. And so I am lucky because for whatever reason, I manifest central weight as my form of insulin resistance. It doesn't affect my blood pressure at this point. Now I'm 62 now, so it's like I can't say I'm just youthful. Sorry. Um, I get discounts for a lot of things at 62. I can get into the local pool at less expensive than Leo can, and he's 6. And so anyway, so is it just my vivacious youth that keeps it from the insulin resistance from causing high blood pressure, from causing high cholesterol or diabetes? I have none of those things, and I'm actually optimal in all of them, but I still can gain central weight. That will still have an inflammatory effect on me. Okay. And from a personal example, one of the things that happens to me when you try to lose those adipocytes, those fat cells, and you try to shrink them and things, for me, whenever I've tried to lose weight in the past, not only does it cause an increase in toxicity in the body, my Lyme's disease flares up pretty miserably. Okay. So be very clear. Losing weight for me is actually a miserable experience. It's a miserable, it's beyond, anything I'd really wish on anybody. So taking away one level of the problem, it didn't take away the other things this time. It took away the appetite side of things. So now I just had to deal with a flare up of a disease, which is okay, and so
So how'd that go? How is it going? How long were you on it? Like, what more can you share about your personal?
So because of my patients, and I want to be clear about this, I was cautious about these medicines because I thought of them like medicines. Honestly, I didn't look into them enough because, like, I don't think I'm going to use those things. There was this thing about, because you see, be careful if you have multiple endocrine neoplasia, which, by the way, in 40 years of practice, I've never seen one case. Okay, so it's not common. Okay, that's a reason not to use these drugs, by the way. But there's almost no others, to be quite honest with you. If you dose them appropriately, I start tirzepatide, and I actually started at 5 milligrams. The recommendation of many people is 2.5 milligrams, but you start at 5 milligrams subcutaneously weekly. Okay, that's it. It's a little injection into your abdomen using a 31 gauge needle that you can't even feel. Okay, and it's once a week. That's about as easy a thing. It's easier than taking supplements. It's easier than taking anything else. And the only thing you notice is a decrease in appetite. I'll give you a great example from this morning. I was catching up on all of my chart notes, which there were quite a lot. I was off last week, everybody. And one of them is like, I heard the article, but I had such a problem with it before, but I never heard what you said about cutting back on what I ate. She was having problem with nausea or vomiting. It's like, well, that's the whole point of the medicine, okay, or the peptide, so the first thing I tell everybody, if you start this, the first thing you have to do is cut your portions by at least 50%. You have to, okay?
Or you'll feel the side effect.
You will feel seriously nauseous, usually not vomiting. Most people don't vomit with this. This lady did. And I said, listen, she was going through a tough time in her life. Let's try these medicines again sometime in the future when she's going through some grief. So I said, let's not do it right now, because once again, losing weight, everybody, is really tough. Okay. And if you ever hear anybody who says it's not tough, they don't have a weight problem. They don't know what they're talking about. Okay. So for people who need to lose weight, this has been a great thing because it decreases the central brain response of like almost fight or flight that you go into when you're not feeding yourself. Okay. So, because when you decrease the amount of food that you're eating, there's a sense of a lack that can occur. Okay. That goes away when you take this tirzepatide. So I started it in November. I think it was November 1st or 2nd was the first injection I gave myself. And I lost about 25 pounds. I went from, doesn't matter what it was, I was 25 pounds. And I still, at this point, I'm shifting into a bodybuilding mode where I'm going to continue on that, try some other peptides to help with some muscle mass gain, see if that works as far as that goes, and start looking into this world of peptide hormone therapy. Peptide therapy, if anybody out there hasn't heard about it, is something that is coming to the forefront of the functional medicine world. The number one peptide class for your doctor and for you to be aware of are these medicines. Number one, semaglutide, which I actually skipped over that error. I have a few patients on semaglutide. They're still using it. Semaglutide, once again, is the first GLP-1 receptor agonist that came out. And brand names are known as Ozempic and Wegovy, but they can find them on their own as semaglutide. The patients of mine who've been on that and are doing well, I don't switch them. Okay. If I'm starting a GLP-1 receptor agonist slash GIP, which is this Tirzepatide, I'll start usually at 5 milligrams subcutaneously weekly. I usually don't go any higher than that unless the person really needs to lose more than 50 pounds. Okay. Because as you start to get to the stages where you're losing 50 to 100 pounds, going up higher will make a difference. You stay on that low of a dosage. Okay, then and you just cut back from the very get-go by 50% your portions. I'm telling you, everybody, start there. Okay, because you'll feel less hungry. You try to eat more than that. Anything close to what you ate, you will feel nauseous. Okay, you will get a stomach ache. Okay, but if you actually just pay attention, okay, and don't eat so much, that won't happen. And I'll promise, the reason I know that is on occasion I went to eat on this, in the last few months where I ate something like more like I normally did, and it's like, oh, I shouldn't have done that. Okay, because it felt like I ate way too much, even though it would have been something normal for me, 3 or 4 months ago. And so as long as you don't do that, you'll get reminders. If you don't do that, then you'll
Wait, I
actually
gotta
be
pipe
fine.
in here. I gotta pipe in here and just say I had this thought where now I'm feeling bad for all those people that got like the gastric bypass surgery. Like clearly,
Yeah.
like if this drug had been out, they might not have
They
needed
wouldn't
me.
have needed it. They wouldn't have needed it. And so, and
Damn.
gastric bypass surgery really isn't good for you. It
So it's not
does work.
that's kind of like gone by those doctors are probably like, oh, we're going out of business now.
This will absolutely take them out of business as long as
Right.
doctors prescribe them and prescribe them appropriately, because the people that got into a problem was kind of more of a Hollywood thing. The actress who was trying to suppress, so much of her appetite to lose another 10 pounds to get wafer thin, and was misusing the medicines. Doctors who often did the early compounding prescriptions were using way too much. I mean, they were prescribing. I had patients who were given on these online pharmacies like 15, 20 milligrams a week
Oh
of this
shit. Versus
medicine
the
and
5 or
versus the
2.5.
5.
Yeah.
And that's an enormous difference. And this goes back into using your oven right, using any tool right. You use a tool wrong, it's going to hurt you. All right. So catch me up. Where were we now?
All
Oh,
right. So,
sorry. We were
the
talking
the
about the
second set,
Tirzepatides, using the
not the
right dosage.
Ozempics.
The people were
Well, we're
using
talking
too
about,
much,
sorry, the
right? So the
overdose.
Tirzepatide,
Overdose. The
so
overdose
people
that
were
the
overdosing
doctor's
with it, and
doing.
it really
Yeah.
was. Right. So they were doing too much to get people to what they're and losing weight too fast. So anybody, for any reason, who tries to lose weight fast will have an issue, because, and this is really important, because you can end up, with serious issues from the standpoint of like getting gallstones, needing gallbladder surgery. It can exacerbate liver issues. So this is why when I did the articles, I was being very clear with everybody about, we really have to, make sure that people get on liver support, they get on fiber, they get on magnesium. So we deal with some of the complications that occur, and the most important complication, of course, being this constipation, and that if you do the right forms of fiber, you do the right forms of magnesium, you do some liver support, you really are doing such a dramatic improvement in terms of helping people. It's just crazy how much better people can do with this. It's such a good thing.
You know what this
And
reminds me
so
of? I'm
that's why
thinking
I would
of.
tell you is that
Uh, Sorry, I don't. Maybe we're having a connection thing. This is making me
sorry.
think of this is making me think of the whole idea of like, okay, let's say you've got the obese diabetic who reaches for the candy bowl, and the friend's like, hey
Mhm.
man, you're a diabetic, and they're like, well, I'll just shoot more insulin. Okay, right now we know that that's like the worst thing that you
Right?
can do, right?
Worst thing
But
possible.
Right, worst thing possible. So I guess I would
Mhm.
say the same thing here. It's like, look, you're going to take this drug and it's going to help you. Don't be a dickhead. Don't be an idiot. Go do stupid, like do the things that, right? Like don't go shoot your extra insulin so you can have extra candy ball. Don't overeat so you don't get
Right.
nauseous. But I think what I'm equating it to is then do the work that you can do for the support you're being given by this drug, right? Don't just take the
Correct.
drug, go off and,
Exactly.
be a whatever's like, go
Right.
actually correct all the stuff. You
Hmm.
have the opportunity.
Right.
This is your chance. Don't, no, I don't even mean abuse it in terms of amounts. I mean abuse
Right.
it by not taking it to its full potential. Does that make sense?
Right. Very much so, because that's the whole point is that and again, I just had a friend, his son is about 100 pounds overweight. It's like his son, he forwarded my article on the Tirzepatide to his son. His son kind of got excited about this, and we'll take you through all the emails we sent back. But here's a way to do it. Here's how to get it, how to utilize peptides. So we have a whole section on how to utilize peptides, because most people are going to have to get this, like buy it like a supplement, okay, right now, because they're not going to get it covered through their insurances. Okay, and we'll talk about that more in just a second. But the idea, like I said, of the article is if you do these things, because true integrative medicine is like Western medicine has some good things, and so the peptide therapies is one of the things my patients kind of like when I say pushed on me. It's like in today's world, I'm looking more at what's called inductive reasoning. I'm looking at wholes, not little pieces. Peptides are small pieces of you. Okay. And so I'm trying to look at the bigger picture. People wanted me to look at the smaller picture, and I was being like a little like petulant little child. It's like I don't want to look at that stuff. Um, sorry,
Right.
really was like that. And then so many people have these things. All right, I promise I'm going to look into these things, because they were spending exorbitant this is a couple of years ago, exorbitant amounts of money to get these things. And I said, listen, I'm your doctor. I don't want you to go online. What pharmacies you're getting these from? You're going to get some bad advice. Let me look into this more, and I will look into this for you. So that's where this, like I said, the article that we just put out was called Tirzepatide, The Time Has Come. Now, there's a lot of doctors who are prescribing this long before me. I want to make sure everybody hears that. I actually referenced a New England Journal of Medicine study that just came out, which is a 3-year safety and efficacy trial on this drug. So be very clear. It's not been around long enough for us to be really, to answer some of your questions from earlier. What is this going to, is this going to be safe long term? Boy, all the implications of the research is it's like the far-reaching benefits in terms of cardiovascular disease prevention, Alzheimer's prevention. There might be never another class of medicines, again, a peptide, as safe as this, that will do so much to prevent so many diseases. That's how
Right. And,
important this stuff
and I
is.
want to just
Okay.
get back to basics from the beginning of the conversation by sharing with the audience, meaning a lot of those diseases stemming from terrible blood glucose management, right?
Correct.
Not just by the
Exactly.
person, but also in the body because of
Right.
the person, unbeknownst to them, making choices, turning yourself into a hypoglycemic sugar addict. We've written about this, we've talked about this. But yeah, I mean,
Mhm.
and then we're back around to now you feel good. You've got more
Right.
confidence. You feel good in your own body. Your brain is sharper. You're not falling asleep at 2 p.m. because you ate the pasta because you're not
Correct.
doing that anymore.
Right.
And now you're just a better person. You're probably a better daughter, a better mother, a better right. And then
Exactly.
and there we go. So
And
yeah.
you'll be a better actual person. Okay. And I mean that in all sincerity. Obviously, when we say it that way, everybody, the idea is you can actualize the person you are better, because you are not in as much pain. You feel better. You can move around better. There's so many people who talk to me about like not even able to be put on their shoes because they have so much weight, and
Yeah.
tie their own shoes. And it goes on and on about these things. So there's so many things that kind of come around in terms of how you can feel about yourself. This is really important. Nobody is out there, and I've certainly never fat shamed anybody. Okay. And so I, maybe when I was a kid, okay, but so the reason being is because I've had weight issues myself. And so and I would tell people that this is something that is far safer. Because well, how do you know that something like fen-phen, that's the
Right,
phentermine
old school.
thing that happened, fenfluramine combination? Well, because it's nothing like that. These are not poisons. These are stimulating receptors that are in your body. The reason I think that we're missing and need stimulation of these certain peptide areas is because of all the things we talked about, because of the stress factors, the adrenal factors. So many things have affected the ability for our body to make these peptides effectively, and that we can renormalize our appetite, normalize our food choices, normalize our choices in so many areas, okay, by working with the most common disease that is the foundation of all of internal medicine, which is this insulin resistance, central weight gain, blood pressure, blood sugar, cholesterol problem. And instead of throwing drugs at each and every one of those epiphenomenon, other things that spring forth from this, that can't work long term because you're not even dealing with the underlying problem. So, and just so everybody hears this, the person goes on a diabetes medicines for like 6 months to a year. Their blood sugar is lower, and they go, "Wow, medicine's really working. I can keep eating more of the stuff that I'm not supposed to eat." That's actually the way they look at it. Okay, nothing is gained by that, and before you know it, they're on 2 diabetes medicines and 3 diabetes medicines, 3 diabetes medicines. A blood pressure medicine, a cholesterol medicine, and a partridge in a pear tree. I mean, it's crazy, and they're on these multi-drug phenomena. And by the way, once you're on more than 3 medicines at a time, there's 100% chance there's at least one drug interaction. Okay. So the drug therapies that your doctors are using are absolutely working against you. Okay. Now, whereas this is a peptide hormone therapy working with a natural system within your body that helps recalibrate how you approach food, okay, and your appetite in general, okay. Now, and I would just tell you, this phenomenon of helping with appetite, I think, is an exceptionally important thing, okay, and that's what the primary effect of this. My article, by the way, gives you a dozen other mechanisms of working on insulin levels and glucagon directly, okay, which is of course very important. So be very clear. There are other central nervous system effects. I have patients who swear that it's helped their OCD more than they've ever had anything else. Their ADD more than anything it's ever helped. Okay. So there are central nervous system effects that go beyond helping with appetite. Okay. So this class of medicine, which I said Tirzepatide is where I jumped in terms of being aggressive, moving to this next one that's coming out called retatrutide, more to be seen. Just know that there's other members of this family coming out, and it's a weekly injection. And I know that it's tough for a lot of people. They're so afraid of needles. There's it was one group of doctors say, if you mention
I'm that person. I
you
can't.
mention an injection to people at like the 70 or 80% chance that their brain will shut off right at that point.
Yeah.
It's like end of story. He just said injection. Well, again, I would just tell you, it's a once a week injection. A 31 gauge needle, by the way, is something you can't almost barely feel. That is so easy to give to yourself. Okay, and it's once a week. It's easier and it takes less time than taking like vitamin D. Okay, in terms of like taking, if you add up all the time, taking it every day or something.
And I want to be clear too. This obviously, look, anybody as an adult has the right to go seek this out from your practice or anywhere else. But
right,
clearly, we would say, hey, look, start with a 21, try to go paleo, see if you could do it on your own. Why mess with it if you
absolutely,
don't have to? But this
of
is really
course,
for the people, like you said, you've tried, you've done a bunch of stuff, you
right.
can't get past it. And sometimes people just look, sometimes all you need is willpower for a few days if you go paleo to lock in that appetite suppression and get sort of
Absolutely.
turned over, but sometimes not. And if you're one of those people, this could be your answer.
Absolutely. And so, and yes,
Or if
absolutely. If
you're
you
too far
can,
gone, like if you're seriously very,
if
very
somebody's,
obese and it's
but that's
just so
the other,
overwhelming emotionally, then
that's the
go for
first group,
something to help
the
you
one you
out. Yeah.
mentioned. Yeah. And then the next group is some people that's so far gone that they have no gumption. They have no ability to
Yes.
start those things. So, I have my share of patients. Like, trust me, when they're so fatigued from being obese, they're so fatigued. Okay. Because it's a pro-inflammatory state.
Hmm.
Okay. That they have enough energy to make it to work. They're not being paid enough at work. Now, that's another global part of this problem, by the way, is the indentured servitude of the average American. Okay. We're imprisoned by choices at that point. We make poor food choices. We don't have the money. We work way too much in our society. Therefore, we don't have the time to take care of ourselves. So remember, there's so many things that are going into this that they have no energy to exercise. They have no And of course, you and I both know, Elle, that for me, and it's been true no matter what, even no matter what I weigh, I exercise because I feel better when I exercise.
Yes, me too.
Okay.
It's a
Um,
mental thing. Yeah.
and so, and obviously I could feel tired, and I know that that means I need more exercise, actually. I mean, of course, it can mean you need more sleep too. There's other reasons for feeling tired, of course. And so, but for me, I know that if I don't exercise well, I won't sleep well, for instance. Okay. So it's selfish of me to exercise. When I say it that way, it's self-care, actually. Okay.
Mhm.
But yes, we have to do that to some degree. But yes, what I'm telling you is that the safety of of this peptide hormone therapy has actually been proven, and the benefits that are coming down the road from what we will see from it makes it something that should be available to people on a mass scale. And like I said, I think actually there's groups of people in the country, because it would free you, okay, from the food addictions, from big pharma, from big food. They actually fear these medicines becoming more popular
Well, yeah, because
because
then you're not going to go buy all the crap, and
because
they want to push the crap.
it'll move you away from the big foods, and it'll move you away from the big pharma drugs. Okay. And and I
Let me
can't.
throw out another benefit here, though, too, because we talked in the beginning about how finances can be stressful. There is no better way to improve your finances than to stop eating a bunch of garbage. The money that you will save, right, on the caloric drink at
Right.
Starbucks that you got with the whipped cream or whatever you're not doing now because your appetite is suppressed as a result
Right.
of this peptide. Um, and then also, I just have to say, from someone who was a food addict as a result of being hypothyroid and all of that junk,
Mm-hmm.
and I can tell you that the difference is astounding. Like when you have the loss of appetite or a controlled normal appetite, my God, you can like actually focus on and enjoy on the moment and things in life. And it feels like it's such a distraction to
Mm-hmm.
have to have the cravings, right? To feel like you need to open the fridge every 2 freaking hours, which was me. It feels obsessive. It felt like I did have an addiction. And granted, I didn't know that I had kind of yeah, what was going on at the time. But
Mm-hmm.
now that I am satiated, wow, it's amazing when you don't have to think about food, how much you get done in life and how much more
Right.
creative exploration is available, right?
Exactly. Yeah, exactly. And so the whole idea, everybody, is that in many ways, and be clear, if we can keep the prices down. So let's go to the next step. So these drugs are available for diabetes only right now. Okay, in terms of through your insurance company, and tried to get drug authorizations for my people who wanted to use it for overweight, wanted to use it for pre-diabetes. The insurance company wouldn't cover it, and the cost would often be like $1,500 a month to try to do this very medicine. Okay, so that's not acceptable. Okay, so that's also what got me into saying, all right, let's find. And I worked with a compounding pharmacy. Like I said, effective March 19th, that's 2 days, the compounding pharmacies will no longer be able to distribute these medicines. That's the way I wanted to do it, to keep it, because that's my doctor model, right? I use pharmacies for things, right? So
Right.
I mean, Gary, that's kind of shocking. No, not really.
Hmm.
So I tried to do it that way, but now that methodology is being taken away to try to force you guys towards the big pharma company versions of things, okay, which would cost a ton of money. There are these peptide companies. They are like supplement companies, except for they make things that are available for people to purchase on their own without a prescription. Okay, so I want to be clear: you can get Tirzepatide through a peptide company. The one I'm recommending the most right now is Peptide Sciences. Have no official relationship with them. There's dozens of other companies that I'm exploring, but I still, like I said, I'm kind of new into this. Okay, so I'm recommending one and saying you can actually buy this without a prescription. Okay, and it won't be as low as the cost for my patients was $160 a month at 5 milligrams weekly, which is you'll save yourself enough in food, seriously, to
Right.
cover that. Yeah, I'm actually not even kidding. Okay,
No, I definitely know this.
and
Yes.
um, so so it'll be maybe closer even to $300 a month if you use the peptide therapy companies and get the same dosage. But they'll have these caveats. So anybody who wants to ask us, we have a whole handout on how to utilize peptides. And that's on how to mix them up yourself and how to inject yourself. Sounds scary. Okay. Now, I'm a doctor. Obviously, this stuff is not scary for me. Okay. I actually started at about the same time, actually about a month after, and a different peptide, just to give you an insight to these peptide therapies, called Thymosin alpha, excuse me. And it's been around for 40 years to treat intracellular infections. You know what I have? I have an intracellular infection. I learned about this and I was like, why don't I know more about this? Because there's no drug company promoting it to anybody in the world. Okay. And that was one of the key differences in me getting over this Lyme flare, is adding a different peptide that I do twice a week. Okay. To treat my Lyme's disease. Okay. And there's therapies coming along these ways, and it's replacing a thymic hormone, which is another peptide hormone that we're missing with age. Okay. That can be profoundly effective at dealing with chronic intracellular infections. And that's that could be a whole nother talk, Elle.
Right.
So yes, there are good peptides. Be clear. The peptides that most people are hearing about are mainly promoted through the bodybuilding industry because they're used to promote, lean body mass, getting shredded, and all these other terms that we're talking about. And those I still have to evaluate more. I'm taking a one at a time Dr. Gary approach to this as far as that goes, and saying, well, what has the most evidence? What has been around long term? So, am I worried about the long-term use of thymosin alpha? Let me see. It's been studied for 40 years in a gazillion different conditions around the world. No, I'm not worried about the long-term effects of that one. I can recommend that one and experiment with it was appropriate for me. Okay, as far as that goes. And so then back to this one. How long am I going to do the Tirzepatide? By the way, I'm actually experimenting with the retatrutide, right now, because I don't mind using myself as an experimenter in this area. I'm not going to generalize my experiences with everybody else's, by the way. I'm just going to say, what differences do I see? I don't see a whole lot of difference, by the way. But on that order, play with different things. What are the most effective therapies for different people as more data comes out? Okay. But I cannot emphasize this enough, Elle. The treatment of the number one most important disease of our day, getting closer to an actual cause than anything else that's ever come out there, makes this class of peptide hormone therapies probably the most important thing that we can actually talk about for the health of the average American.
Wow, that's really amazing. And honestly, for the audience and to you, but in general, like I was actually shocked that this was something you wanted to talk about, or that
Yeah.
I was actually, because I'm friends with a lot of because my friends are all your patients.
Yeah.
Because I've turned all my friends to you, but
Thanks.
one of them had called me and said, "Hey, I'm gonna try this," and I was like, "Oh, okay." And they're like, "Yeah, I talked to Dr. Foresman." And I was like, "Wait, Dr. Foresman's prescribing you this?" And they're like, "Yeah." And I said, "Okay, hold on." I was like, I mean, not that I know you prescribe everything and you've done everything and you're not anti this or anti that or pro,
Right.
you know what I mean? I know
Right.
that's why it's middle path medicine. There's
Yeah.
always some middle
Exactly.
ground, but it's very fascinating. Um, and also,
Right.
I would say that I personally would, of course, only trust the way you would look and approach these things, because obviously there's
Right.
doctors out there making some dosage mistakes. So these
Correct.
are really important things for people to think about before
Right.
getting on this
Yeah.
train. This is
Well,
fascinating.
and then the whole point of getting off of them, as not only as because in my article I bring up our foundations of health, which you and I both know, my basic nutritional protocol, but I have a whole list of things that I would tell most everybody to take with us, including creatine. Okay, we could do a whole broadcast on creatine if you wanted to, but creatine not just for muscle mass, but for brain health. Okay, but along with HMB, which is hydroxymethylbutyrate, which is another amino acid used to support lean body mass, because the beauty of this is that not only in losing the weight, I was able to maintain lean body mass, but pretty dramatically decrease body fat. That's what everybody's hearing. You don't want to use these Ozempics or whatever else like that, because all you do is lose a bunch
Water
of
weight
lean
or
body
whatever.
mass, and that's all, and it'll all cycle back with you, and that's if you don't pay enough attention. Okay. And so
Hmm.
you do creatine, you do fiber support with this, with lots of water, along with a green supplement. I strongly recommend to most people, because your appetite's going to be down. You're probably not going to be like your mom
You're
and
not
eat
going to be eating broccoli. Yeah,
broccoli
yeah.
every day. Very good. So you do fiber support along with this. You do extra chromium and magnesium, because those are so important for activating the form of glucose transporters that have been downregulated in insulin resistance to activate and turn white fat to brown fat, which means the metabolically good kind. Okay.
See,
So
so
you
many facts, so many nuances.
do.
This is why
So
you are an important doctor. You have the nuances. Yes.
that's the thing with integrative medicine. You've heard me say this, like so many people, like when we're treating cancer, do I do those natural things or do I do chemotherapy? And the answer is, why are you in the or camp? Okay.
Right.
The answer is integrative medicines mean we integrate the best of these things. There is actually a time and a place to do chemotherapy. There is, but by the way, but there's a whole shit ton of good reasons to support that. And the doctors who do chemotherapy will tell you not to. And I'm going to tell you to do it because
Right.
there's a
The things
lots
to
of
support
evidence.
along the way. Yeah.
And that's the whole idea, is to support your body when you're like kicking its ass with chemo. Sorry.
Right. Yeah.
And the
Yeah.
same
And
thing
the same
goes
goes
with
here. Yeah.
it's here. This is actually tough on you because when your fat cells shrink, the toxins that have been stored in your body release into your bloodstream, lowering your metabolic rate. Okay. So you have to detoxify. That's why I emphasize liver support and magnesium and fiber to keep your bowel movements going. Okay. Because that's a real biggie. Okay. And doing the things that support you, because then you'll have normal bowel movements. So the other common side effect beyond the satiety, sorry, I'm feeling full, is the constipation one. Almost everybody's heard of that one too. That's easy to treat, but to prevent and treat. Most people, again, my impression, a lot of the world is constipated. Sorry. So that's a big important thing to do, even if you don't treat, with a GLP-1 receptor agonist. And so what things do we do to keep the bowels moving, to support the liver, and to shift your metabolic function towards the healthier version of the glucose transporters that goes into the problems with insulin resistance and excess fat mass, everybody. So I'm trying to keep this as non-technical as possible, but there's a whole lot of reasons to do these things. So, because the goal isn't to keep you on the peptides forever. Okay. The idea is to get to your goal of therapy. So you would do, let's say you get there at 5 milligrams, maybe 7.5 milligrams a week if you need to, and you get to your goal. Okay. And the idea at that point is to actually continue on and say, all right, we're going to do it. And there's a couple of different ways. You go to say you decrease it by a couple of milligrams or a milligram. You could easily do it in any number of ways, but you do it slowly. So you're going off like over a several month period. You see how your weight's doing. This is a really important thing. By the way, this is no more complicated than when I tell my patients that when they lose the weight and they need to get off their blood pressure medicine, I need to monitor your blood pressure every night between 6 and 10 p.m. These are the numbers I want you to keep you done, and I want you to decrease that medicine by so much. They monitor their blood pressure, and guess what? Their blood pressure does fine. They get off their medicines as long as they monitor their blood pressure. So guess what you got to monitor here, as you're trying to get off of these things? You monitor your weight. Okay. What happens if it starts creeping up? Then you go back to your previous dosage. Look at what things might have changed that your weight's going back up again. And you make it this model of self-inquiry that I love to use. It's called neutral self-inquiry. I wonder why my weight's gained. Oh, you know what? I've brought back, chips at night, whatever. I'm snacking more at night because my appetite isn't suppressed. Well, okay, I guess chips at night is probably not the best thing for you. And then you come to a realization, and then you stop doing that. Then you start tapering again. Okay. And will some people be out there that need this long term because they just keep gaining weight without it? Yes, there's some people who stay on blood pressure medicines for the rest of their life, cholesterol medicines for the rest of their life, etc. Most people on cholesterol medicines, by the way, shouldn't be on them. Okay, that's a whole nother subject, but they're actually not treating the underlying problem. They want to listen to their body. They'll find I can't, even just today, on my patients who are just even doing the tirzepatides and sometimes semaglutides, how much their cholesterol profiles have improved. Sometimes long before their A1C, sorry, that's their diabetes test, will improve just by losing weight. Okay. And they will no longer qualify for that cholesterol medicine or the diabetes medicine, blood pressure medicine. And it's like I said, my patients are the ones who got me into doing this because they're having so much success. And when you do this correctly, you will not have side effects. Now, when I say it that way, everything in the world can have a side effect. Okay. People can eat blueberries and get hives. They should not eat blueberries. Okay. So I'm not telling you that there's no chance.
I wish. Yeah,
okay. So that you'd have this issue. So there can be nuances. You need a provider who understands how to use them. Okay. There's no reason you have to adjust by 2.5 milligrams at a time. You can adjust by a milligram at a time, because especially when you draw it up yourself and it's not in an auto pen, you can actually adjust by a milligram and not by 2.5 milligrams, which is when you have the clicker pens that come from the drug company. That's the only option you have. And guess what? Some people fit better with an in-between dosage. The higher dosage is a little bit too much. The lower dose is a little bit less. When you draw it up yourself, you can actually change the dosage by a half milligram, a milligram. You have the ability to make these changes. Do it with a provider. I mean, seriously, somebody who's knowledgeable about this stuff. Okay. But you are supposed to be your own best healer. These things are actually available like a supplement. The peptide companies have to send a form to you saying not for human consumption, for research purposes. That's their workaround to get these things to you. Okay. These things, you're not supposed to consume them per se, actually, which is true. They're actually injectables. So this is a whole world of therapy that's coming about. Gary, are they going to be peptides in the future that you can take orally? The answer is yes, but there's nothing as effective as doing the injection. Okay. The peptides will be broken down by your digestive tract and make it vastly less effective. Okay. So that's why you do a subcutaneous injection once a week. There are many takes on this. By the way, if you get into this world about people are, having you do it 3 times a week and saying that's better, the half-life of this is such that you only need to do one injection once a week. Okay, which makes it so much easier. Okay, and it's a subcutaneous, meaning in your little belly fat, you just stick a tiny little needle and you squirt it in, and you're done for the week. It is simple as anything you can do. I do recommend doing the support for your GI tract, doing the support for your detoxification systems in your liver, okay, and doing support for your muscle mass, okay, because these are things that can be affected more than you want when you're losing weight. Okay. Is it successful? My patients who really go for it, which I mean they do pay attention to their diet, they do really well. People who just think that they're gonna, it's gonna work for them, like their other drugs do, it won't work for you very well. Okay. Meaning that when they're not willing to change the exercise patterns and the other types of things. And so I think it's something that's a really, honestly, it's become in my mind the most important breakthrough in cardiometabolic medicine that I've actually seen in my entire career as a physician.
That says a lot. So I think this is a really important
Yeah.
message.
Yeah.
And it's so much more than
Right.
any kind of superficial outcome that
Yeah,
people are looking for. And I think
correct.
that
And I'm
people
not,
need to approach it
yeah.
with that in mind, too, that this is
And we're not doing this so
broader.
you can lose 10 pounds to be a Hollywood actress or something. That's not
Yeah, right.
that's not my thing. Okay. You know that. I mean, people can you can actually choose to do whatever you want out there. I'm not trying to even make that wrong. What I'm trying to tell
But
you
just
is
lie to Gary about it.
exactly. So there's a good use for this support. It can make your life so much doable while you create this body that prints out the way you see yourself. Okay. Without any idea that you're going to be the underlying better person part of it, the idea of more empathy for yourself. Most people's inner conversation when their body doesn't print out the way they want it to is not very healthy. That inner conversation, I think, gets turned out into the world way too often. Okay.
Yeah.
And we look for scapegoats and, in so many ways. And like I said, everybody has to see that in the world. The scapegoating of people of color or whatever, the different religions, there's scapegoating. Whenever you other anything, you've just created a fantasy. And so we are the same people. You will be the same person if you weigh less. Okay. However, your ability to see yourself as just part of the human race will be much clearer because your inner conversation will be kinder. That honestly is my biggest thing, not actually your cardiometabolic health. If we can create a world of more empathetic and compassionate people, that's what I'm looking for. Okay,
I
because
love it. Yeah, what a great overall message on that. It's that's the true end result of what we
that's
want.
actually what I'm looking for, because I
Mm-hmm.
do think part of the reason people vote against their self-interest and do the things that they're doing in this world is because they feel so badly about themselves. And if we can do things that support you to feel healthier and better and see yourself more clearly in a kind, loving way, then that will have to spread out to the other people around you, even if they see the world differently than you. Okay. And that's why I consider it so important. But if you, again, middle path medicine, the article is Tirzepatide, the time has come. There's what I do for support there. I know this is going to be odd. Even you're a little surprised that I'm recommending
I am.
a,
We'll put the link in
a,
the show
a,
notes, by the
a,
way, to the
a,
article. Yeah.
a peptide hormone therapy. And this is a very important shift that I want everybody to make. I'm still in the process of doing it because I still occasionally call it a drug, don't I, guys? So
Right.
I'm still in the process of doing it. And this is a very important thing with what our minds do. The conditioning of our mind goes back to old conditioning and calling something a drug. This could be called a drug if you so want it to be. The actuality of it is it's a 39 amino acid peptide. Okay, so it's a peptide hormone therapy is what it is. It is there and I want to be clear. My goal of this is so you don't take toxic drugs. Okay. I mean, I really got to emphasize that. And I think it'll be a way of keeping away from so many medicines that really don't come close to treating the underlying problem, which is this insulin resistance syndrome X phenomenon that we've been mentioning. And there are nutritional support things that can make it work so much better. That's another part of what's missing from all the research is they're done by drug companies to only assess the drug. And I'm interested in an integrative approach that brings in things to support your body while you're going through something that's really tough. Okay. And everybody's heard me say this, losing weight is tough, even with these things. Okay. Even with the GLP-1 receptor agonist. And so, but it gives you hope. Okay. It gives you a chance to go through it without the same degree of angst and irritability and things that kind of come with the excessive, overwhelming hunger. And it helps you make better choices. It really does. And so, and that's what I'm looking for people. And I think this gives people a lot of chances to do this because, yes, we could call it a drug, but I prefer calling it what it is, a peptide therapy. Okay. And that's something to help support your body to get to the best. And again, be clear, it could be weight goal, it could be blood pressure goal, it could be cholesterol/triglyceride goal. It could, of course, be, blood sugar goal as well. Because as you know, everybody, we use a better version of called the hemoglobin A1C, and we shoot for optimal, which is 5.2, everybody. So trying to get people to optimal blood sugar. Okay. And so, because there is a huge amount of disease out there. But long before your doctor calls something diabetes, actually 50 to 80% of the damage from extra glucose occurs before your doctor calls it a diabetes. Right. I want to make sure everybody hears that. Okay. So we got to get people to optimal blood sugar, not just to not diabetic, because even these A1C goals you hear on the TV, my doctor got me to under 7 or whatever else. Well, that's cute and everything, but not even remotely where we need to go.
Well, that's still diabetes.
It's still diabetes.
Okay, by the way, everyone, Dr. Foresman and I have talked about this on several episodes in the past, but just so you know, and I'm assuming you would say the same, you're shooting for on HbA1c 5.2 or below.
5.2 or below. Okay.
Don't let a doctor tell you 5.7 is fine. 5.7 is prediabetes.
Prediabetes. Very good. It is. And it's a huge problem.
Why I know it? Because I had an HbA1c once of 5.7.
Exactly.
Yeah, no, it's no joke, everybody. So 5.2 or below is what you're shooting for. Right.
Can I just want to emphasize that when your A1C goes from 5.2 to 6.0, at 6.0, which your doctor will call normal, okay, from 5.2 to 6, your risk of having a heart attack 250% higher at 6 than at 5.2.
Okay, I knew there was this.
You're losing twice as many brain cells every day at 6 as you are at 5.2. That's how much damage is occurring in this supposedly normal glucose range. Okay, and it's not normal. Okay, it's just the misinterpretation. Again, you can edit me out as much as you want, Elle. I was taught as a doctor that by a type 2 diabetic, this is the classic adult onset, the type 2 diabetic already had end organ damage at the time of diagnosis, which never made sense to me. And the answer is very clear for everybody. You have a problem. You could actually call anything above 5.2 on that hemoglobin A1C a disease. Okay.
That's a real ass kicker right there. For everybody get that HbA1c.
And the same thing, like for some god awful reason, Quest Labs uses a fasting insulin of anything under 18 supposedly is fine. This is true. I don't know if you know this, Elle. The reference range, I think, at Quest Lab for a fasting insulin is, I think, 17.8. It's something like that, everybody. A perfect fasting insulin is 5 or less. 6 to 10 is borderline, and anything 11 or above is like in the red, should be in the red, and like alarms going off. So fasting insulin should also be about under 5. that fasting insulin especially is addressed better by stress management, healthy sleep, healthy exercise, as well as getting a better blood sugar, of course. So fasting insulin under 5, we were looking for you to be optimal, not just not diseased. Okay.
Yeah, I love that.
And it's so important for you guys to hear it. You go to a standard doctor, and let's say they ordered a fasting insulin through Quest and it was like 15, which is way too high. It wouldn't have an H or an L or anything next to it. So, oh, my insulin's fine. Okay. And that's the kind of, support most people are getting from an average doctor. The average doctor probably won't order a fasting insulin on you, by the way.
No.
But anyway, so the references we're using are so important because they're based on being optimal and not just for brain health and heart health. I'm talking about human health.
Right.
And that's actually why I consider this so important. It'll make a huge difference in terms of people getting to optimal blood sugar, which will be so good to improve our health span. And I'm sure you've done podcast galore on lifespan versus health span. And we want to improve lean body mass. We want to keep these numbers. We can, as optimal as possible. And it gives us the greatest chance of increasing our health span, meaning as we go along. And it's like I'm 62 with a 6.5-year-old kid, and I still can do a lot of things that I have a lot of patients even younger than me now. Like, I'm going to sound like an old fart right now, that are just really not doing well, and they've bought into the idea of 62 being old. Okay.
Yep.
And it's not old. I mean, and I don't know if I'm going to go all, what's his name? Peter Attia, or whoever that was. We're going to live to 180. I don't know if I'm going to go that crazy, but we can absolutely live to 120 healthily. Okay. But are we going to want to? And that's our health span, and that's going to be focusing on. So why am I working on like lean body mass and more bodybuilding now? Because I want to do some things to bring the lean body mass up, because that's another thing that correlates with my health span. Okay.
Right.
And these are things to do to be healthy. It's not about looking good in a bathing suit or any of those other superficial things. Because the nice thing about 60 is you don't really care that much about that anymore. It's not that it's a bad thing. I'm just saying is the goal is more about something much more important. It's about being optimally healthy. And that's, to me, why it's so, I know it's so surprising for many of my patients that I recommended what they're considering a toxic drug. It's really not a toxic drug. It's a peptide hormone therapy. It can be used in conjunction with other integrative therapies and help you get to goals that will hopefully prevent you from being on a whole bunch of other medicines that really would be quite harmful for you. So that's why I consider this to be such a breakthrough, is to get on this, because even if you need to be on them long term, which is not my goal, of course, okay, I still see that there's long-term benefits from being on them.
Yeah. Oh, all right. That was wonderful. Thank you so much. We're going to put the link to the article in the show notes, and you can visit middlepathmedicine.com to learn more about Gary Foresman, also on the Paleo Thyroid Solution and also the Ultimate Thyroid course. Amazing tutorials and feedback there. Thank you so much for sharing your wisdom again. And for everyone else, we'll see you next week.
Well, thank you. Thank you.
Hey, thanks for listening. If you enjoyed this show, I would so appreciate you leaving a review on Apple or Spotify or wherever you get your podcasts. And to learn more about partner discounts on amazing products, visit elleruss.com/discounts.